So, have you ever had that feeling where your body just seems stuck on high alert? You're anxious, you're restless, and you just can't put your finger on why? Well, that feeling is at the very heart of what we're talking about today: hyperthyroidism. It's such a strange paradox, right? That feeling of running a marathon while you're just standing still. You're totally wired, but at the same time, you're completely exhausted. Today, we're going to dig into exactly what's going on when your body's internal engine gets jammed in the on position. All right, so to really get what happens when things go wrong, we first have to understand the system that's supposed to be in charge of your body's speed and energy in the first place. And that all comes down to the thyroid gland. Hyperthyroidism is pretty much exactly what it sounds like. Hyper means too much, and in this case, it's too much thyroid hormone. Your thyroid, which is this little butterfly-shaped gland right here in the front of your neck, starts pumping out way too much of two key hormones, T3 and T4. Just think of these as the gas pedal for your entire body. And when I say gas pedal, I am not kidding. These hormones have their hands in everything. They control how fast you burn calories, how quickly your heart beats, they even manage your core body temperature. Plus, they're absolutely vital for brain function and play a huge role in reproductive health. They're basically the master regulators of your body's entire pace. So, how does the body keep such a powerful system from just spinning completely out of control? Well, the thyroid isn't just a solo act. There's this really sophisticated command chain that's always at play. Okay, so it all starts up in the brain. The hypothalamus acts like the body's CEO. It senses when hormone levels are dipping too low and sends out a memo, TRH, to the pituitary gland. The pituitary then releases its own messenger, TSH, which stands for thyroid stimulating hormone. TSH is the direct order that goes down to the thyroid and says, all right, time to get to work and make more T3 and T4. It's an incredibly precise top-down system. But, just as important as the on switch is the off switch. Once those T3 and T4 levels in your blood get back to where they should be, they send a signal all the way back up to the brain. And that signal basically says, hey, we're good down here. You can stop sending orders now. This is called a negative feedback loop, and it's the absolutely crucial brake pedal that keeps the whole system from going totally haywire. But what happens when that brake pedal fails? Or what if the gas pedal just gets jammed to the floor? Well, that's the exact moment hyperthyroidism kicks in. And this is where it gets really interesting, because doctors can put on their detective hats just by looking at your blood work. The hormone levels give them all the clues they need to figure out where the system broke down. So get this, if the thyroid gland itself has gone rogue and is just pumping out hormones on its own, your T3 and T4 will be high. But the brain, trying to slam on the brakes, will have cut the TSH signal way, way down. On the flip side, if the pituitary gland is the problem, it just keeps shouting orders. So in that case, you'll see high levels of both TSH and the thyroid hormones. Pretty clever, right? Now, the most common reason for all this trouble is a condition called Graves' disease. It's an autoimmune issue, which means your own immune system gets confused. It starts making this antibody that is a nearly perfect imposter of TSH. This antibody hijacks the system, constantly binding to the thyroid and telling it to go, 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 completely overriding the brain's off switch. But while Graves is the usual suspect, it's not the only way things can go wrong. Sometimes little lumps called toxic nodules can form on the thyroid, and they act like their own independent hormone factories, totally ignoring the brain. Other times, the gland can get inflamed, that's called thyroiditis, and that can cause it to leak out all its stored hormones. You can even overfuel the system with too much iodine, which is the key building block for these hormones. And in some rare cases, the problem is all the way back up in the brain with a small tumor on the pituitary gland, which is the source of all those relentless go signals. So we've looked at all the mechanics behind the scenes, the hormones, the glands, the signals, but what does this actually feel like? Let's talk about the very real symptoms of living with a body that's stuck in overdrive. The bottom line is this: every single process in your body accelerates. It's like you're living in a movie that's permanently stuck on fast forward. First off, your metabolism goes into hyperdrive. So you might be eating way more than usual, but you're still losing weight. Why? Because your body is just burning through calories at an incredible rate. Your internal furnace is cranked all the way up, which is why you feel hot all the time and are constantly sweating as your body desperately tries to cool itself down. And it's not just your body. Your mind and your heart are racing right along with it. This can feel like a constant pounding heartbeat, a deep sense of anxiety or irritability that you just can't shake, maybe even a fine tremor in your hands. And trying to sleep? Forget it. Your brain just refuses to switch off. Now, Graves' disease specifically has a couple of very unique telltale signs. All that autoimmune inflammation can actually cause the tissues behind the eyes to swell, which can push them forward. That's a condition called exophthalmos. And the thyroid gland itself, because it's working so hard, can get bigger, creating a visible swelling in the neck we call a goiter. So, with the engine just screaming out of control, how do we finally put on the brakes? The great news is there are some really effective ways to diagnose this and get things back under control. Well, the investigation starts with those detective-like blood tests. From there, a doctor might do what's called a radioactive iodine uptake test. The logic is simple. An overactive thyroid is super thirsty for iodine. It's fuel. This test measures just how much it's drinking up. They might also do an ultrasound to get a direct picture of the gland, just to check its size and see if there are any of those rogue nodules. When it comes to treatment, there are really three main approaches. First up, anti-thyroid medications. You can think of these as putting a roadblock at the thyroid's factory gate, just blocking it from making more hormones. For a more permanent solution, there's radioactive iodine therapy. This is a really clever tactic where you take a dose of radioactive iodine that goes straight to the overactive thyroid cells and shuts them down for good. And finally, sometimes surgery to remove part or even all of the thyroid is the best way to go. And, that really gets to the heart of it all. The goal isn't just to slam on the brakes or shut the engine off completely. It's about a delicate recalibration. It's all about restoring that perfect hormonal balance so your body's engine can run smoothly once again. It really makes you appreciate just how complex our bodies are, doesn't it? The thyroid system is basically a finely tuned thermostat for our entire metabolism. And it just begs the question, what other incredible, precise feedback loops are working inside us every single second of every day to keep everything else in perfect balance?